Hello, everyone. I am Joanne Harris Duff. Happy Pride Month. I'm the program manager for Diversity, Equity, Inclusion Office here at VCU Health System, and I am excited to be here today. It's going to be a fun time. I love celebrating Pride. I love celebrating my people. We are here. So I want to start off by just making sure that folks know that the Office of Diversity, Equity, and Inclusion, we do cultural programming every month. So this month being Pride, we open the month up with an article that features Ron Passmore and Dan Milby, who are a loving couple and have been together for 35 years. They are colleagues right here at VCU Health System, and they have raised two young men who are now veterans. So I encourage everyone to go on the internet, read their amazing story. It will move you. We have had a lot of views and a lot of comments. And for those who have read it and who are on the call today or will be seeing this later, I want to thank you so much for uplifting and supporting your colleagues and Ron and Dan. Thank you so much. Ron and Dan are also members, as everyone on the panel today are members of Pride, which is our VCU Health System Team Member Resource Group. So for some folks who work somewhere else, it is like an employee resource group. So the mission of Pride is to serve and educate the VCU Health System community, everyone, about LGBTQ plus IA health issues, and to create an environment that is supportive of our community, our team members, including our patients, our families, our friends, and our allies, everyone. Something that I've asked folks, that I've been asked is, why are we having a panel today? Why is that important? And so I want to share with you that hearing voices in the LGBTQIA community is incredibly important, because everything we hear, we see, we perceive, whether that's at home, social media, on the news, heck, even for our kids on the playground, or some of us who still like to go to the playgrounds, can be, really tough. And sometimes we hear language from other people and not a community. So today we're hearing voices from our own community, because we don't want to ever leave anything unaddressed, because harmful stereotypes and hearing from other communities who don't quite understand or haven't heard voices from our community here in the LGBT community can be taught negatively. It can affect our life and our choices. It can even affect our patient care and how we serve each other as team members. So this issue is profoundly important, and hearing our voices in the LGBTQ community is powerful. And we want to make sure that we hear positive voices. So there's something else I want to share is, you'll notice throughout the presentation today, when we're chatting, particularly from myself, I'm not sure about the panelists, but for me, I will be referring to the LGBTQIA plus community as queer. And the reason why I'm doing that is because queer is an umbrella term for people who are not heterosexual and who are not cisgender. So the word queer has a pretty complex history with the literal meaning of unusual, strange, or odd. Someone told me today, which I did not know, that queer also, like in its original term, meant stirring. And so my colleague who shared that also shared that she would have a clergy person, when offering words of wisdom, would say, queer folks are here to stir up the pot and get us talking and get us engaged and learning from one another. So that made me incredibly happy. I just heard that right before this program. And so finally, I want to share this. So let me just quick go back. I'm sorry. So I wanted to share that the word queer really came to fruition as the LGBTQIA community taking back that word and reclaiming it and making it something that we're proud of. So you want to call us queer? Okay, we'll take that, but we'll take it, we'll uplift it, we'll make it positive. We will take that negative connotation off of it, and it's our word, and yes, we will use it. At the same time, again, there are many people in the LGBTQIA community, allies, and others that do not use the word queer. And there are still folks like myself that do reclaim the word and put power behind it. So before I introduce our panelists, I do want to share a quote. It is from Chloe McKendrick. She is a queer writer, blogger, consultant, and she works with Lucinda Voices, who advocates for the LGBTQ community. She says, and her pronouns are she, her, and hers, and I'm sorry, I should open the program. Not sure why I forgot to do this, but my pronouns are she, her, and hers. So as Chloe writes here, quote, I strongly believe reclaiming a word that was used as a negative word and using it in a powerful light is empowering and the ultimate middle finger to those who used it to offend and encourage hatred. So most of the folks who know me know that I am all the way transparent, and I always make sure that we have a safe space. So although it says middle finger, imagine that saying a pointer finger from your parent also. Nope, that's okay. And we know that that also means let's think about what you just said. All right. So let's get started introducing our panel today. I'm so excited. So we have Cody Mayne. He is Aviation Outreach Coordinator with Aviation Emergency. Welcome, Cody. We also have Patrick Parker, who's a Communications Administrator, also with Aviation Emergency. We have our friend Julia Payne. She is the Director of Learning and Development, Human Resources. And we have Madison Watkins, Service Center Manager with Communication Center. So welcome, everyone. I want to give a special shout out to Carol. She's here from Communications to make sure that we do what we're supposed to be doing today, and everything streams live and is recorded. This will be posted on the internet. So as you're watching today, I really encourage you to send somebody a message and say, hey, log in. We're having a great Pride panel called Unapologetically Us. And after the program, I encourage you to have someone say, hey, go on the internet, check this out. I'm going to pull a Julia Payne here and say that this does account for our 4 hours towards diversity, equity, inclusion learning requirements. So thank you, Julia, for your face being on the camera and reminding me that that's something I need to share. Okay, before we get started, I would love for the panelists to share just a little bit about yourself before we get into questions. So we'll start with Cody and go for it.
Awesome. Well, good afternoon, everybody. My name is Cody Mayne. I am the Aviation Outreach Coordinator with Life EVAC here at VCU Health. I've been with the program here at VCU for just over a year. Very excited to be a part of VCU and definitely see where this adventure takes me. I've been in the Richmond area since about 2010. I am married to my partner, who I've been married for 5 years, together for 7. We do have a 11-year-old son. So we have a very exciting life as he is entering into his teenage years, getting close to that and getting ready to start middle school. But overall, very busy life and enjoying aviation. I am also a paramedic, been in EMS for over 15 years. Still volunteer on the side whenever I get the opportunity to do that. And that's a little bit about me.
Thank you so much, Cody. Patrick?
Good afternoon, everyone. My name is Patrick. I am also with the Life UBAG Emergency Aviation Department as the Communications Administrator. I've been with VCU. Cody and I pretty much started at the same time. I think it was April of last year. Originally from Alabama, which was an interesting home life growing up. Spent the last 2 years in Charleston, South Carolina before moving here to work for VCU. I'm very excited about this opportunity. Thank you.
Thank you, Patrick. Julia?
Hi, my pronouns are she, her, and I have been with VCU Health for 2 years, but with the enterprise for a little over 6. I'm originally from Philly and kind of grew up in the neighborhood. I have a 6-year-old son who has multiple neurodivergent diagnoses, and I am married to my husband for 14 years, and I identify as queer. I don't know, there's a whole bunch of other stuff, but this just scratches the surface right now.
Thank you, Julia. Madison?
Good afternoon, everyone. I'm Madison Watkins. I have been in my current role as the Service Center Manager for Communication Center, or Telepage, as it's commonly known. I've been in this role for 13 years. I've been with VCU Health for 24 years. I have a total of 30 years in healthcare. I was an EMS provider for 16 years. So Patrick and I have had many discussions about the squirrel tail flapping in the wind for the EMS providers. I am a transgender woman. I have transitioned within the job that I am now. So this was, transitioned older in life, and it's been a really interesting experience transitioning both later in life and without some sort of big life change to correspond with it, and kind of having to move through that and keep going. So it's been a really unique experience. Pronouns are she, her, hers, and I think that's it for now.
Thank you, Madison. Thank you, everyone. Very much appreciated. So we are going to get into some questions. Since I've been here in November, I've learned a lot about several people and oftentimes get questions. And as I said before, our voices from our community is incredibly important. So we're going to go in the same order as we shared. So the first question is, why is working at VCU Health System important to you?
So I would say, working at VCU Health is important to me. It's VCU. When I think of Richmond, I think of VCU. It's every time you turn around, you see VCU. It's in having moved to Richmond in 2010, originally from Roanoke, Virginia. I think the opportunities that are afforded here at VCU definitely help, right? There's a lot of community support. There's a lot of abilities for VCU to have an impact on the community and be able to help provide that support. So that is something that really draws me to that, and the support that I've seen so far that it gives its employees. I know my leadership specifically here on the aviation side has been super supportive in more ways than one, and I definitely have enjoyed that compared to previous employment. So that's one reason that's important working here, that gives me the work-life balance that I need, and seeing that the support and overall balance that VCU can bring to the community.
Thank you so much, Cody. I agree with you. I feel the same way. Patrick.
So for me, working at VCU is important because VCU is, like Cody said, it's so well known. When you think about Richmond, you think about VCU. Everywhere you turn, there is something VCU related. So with working at VCU, we have this in the footprint that VCU covers, there is just this big opportunity out there that we can really harness to where we can reach these different communities and these different diverse groups of people. They say having great power comes great responsibility, as well as having the visibility here at VCU. We can really, a lot of people really look to VCU for guidance, not just for healthcare, but, the university as well. So there's a great platform that's been established by VCU to really take groups like this and really get out in the community and share our experiences and share our knowledge with the community. And, I don't want to say people are more apt to listen because it's VCU, but, when VCU speaks, people listen, especially in the healthcare community.
Yes, absolutely. When VCU speaks, people listen. I love that. Julia.
So I'm very mission driven, and I really feel like I can have an impact here at VCU Health in helping all of us as team members and as an organization really live our mission to preserve and restore health for all people. Emphasis on the all.
Yes, we get that all. Madison. Thank you, Julia.
I've had a lot of personal connections to VCU through my life. I'm originally from South Boston, Virginia. We were kind of strategically placed between Carolina, Duke, Roanoke, UVA, and MCV. My grandfather was a physician down there and was a big proponent of VCU Health, even though he was a UVA grad. I started running EMS in the Farmville community while I was in college there. And this is where we sent our sickest patients. And this is where we also sent the patients who didn't have insurance to go to places such as Chippenham or, some of the Chippenham or Bon Secours or some of the private networks around. So I always had this connection to VCU in that respect. And then, of course, the research and education aspect. When I started looking to work within a hospital and get out of the field, it was here or UVA. And those were my only two choices. And so I've been here for 24 years now and, hadn't gotten rid of me yet.
Thank you, Madison. 24 years is a long time. That is a long time. I love that you've been here that long. I think you're such a good role model for us. So thank you so much. 24 years. All right. So everyone, what is your definition of, Pride Month and being unapologetically us?
So for me, and Patrick and I were talking about this, I've kind of struggled a little bit with the actual theme, to be honest, with this, because to me, the theme itself does not represent what I feel is what we want to come out of this. No one should ever be sorry or have to apologize for who they are, right? Because we are who we are. I'm me. This is me. This is us. This is who we are. So we should, to me, what it means is that, no, we should not be sorry for who we are, but we should also be able to help people learn who we are and why we are the way we are. People think some, growing up as like, we'll send you to a counselor because that's going to change you. Well, no, because that's not how this works. This is me. This is who I am. I'm not going to apologize for it, and the counselor's not going to help fix that. I just need you to accept me for who I am, and being able to work through that and have that support. So, Pride Month, yes, is important, and having that expectation or having that out there is important, but it is a constant thing every month of the year that you have to continuously work towards that to show who we are, show that we are regular people. We are. There's nothing different about who we are just because of who we love or what we do or what we prefer or who we identify as. It's just we are who we are, and being able to help people understand that and work through that and help them come to terms with it to feel more comfortable. If that all makes sense of what I'm trying to get across. But like I said, we are who we are. We should never have to apologize who we are, and we need to me, make sure that we offer that in a way that is in a positive reinforcement to help people understand and grow and get out there the positive message that we need to reinforce it.
Yes, I love that. I was clapping in the background. Thank you, Patrick.
Well, it's kind of hard to follow that, so I'll keep mine brief. For me, it's just about, validating myself and being accepted, unapologetically us. I get where the intent is, but, being part of the queer community, we have been conditioned for so long to feel that we have to apologize for being who we are. I've heard so many coming out stories, whether it be friends talking about it or, watching television shows where people just talk about and they say the phrase, "I'm sorry, this is who I am." Why should we be living in a culture where we have to apologize for being who we are? It drives me insane. And I get why people want to say that. And I get the need for some people to say, "I'm sorry, this is who I am," but it drives me up the wall. We should be who we are and live our authentic and true selves every day without having to worry and without having to apologize. I mean, this is us. This is who we are. So that's my soapbox for that.
Yes, this is us. Yes, love it. Julia.
So I had a lot of the same thoughts as I was, considering the question and how, how to respond. And I think, from a contextual standpoint, looking back even further about how the queer community has lived, decades and decades ago, we often hid, right? We often forced ourselves to look like whatever normal was in that time frame. And fortunately, that is less and less the case, right? And so when I think about unapologetically us, I think I refuse to hide who I am anymore because of someone else's discomfort. I'm happy to have open conversation with people and work through their discomfort a little bit if that's something that they want to engage in, but I can't hide anymore, and I won't live in those shadows, and I won't, make not participate in things because I'm scared of being harassed or leered at or murdered or any of those things. We deserve to live our authentic lives. And so that really is what this means, at least for me.
Thank you, Julia. I agree. Madison.
I mean, a lot of what I'm going to say goes along with what Patrick, Cody, and Julia said. I grew, as I said, I grew up in South Boston, Virginia. I grew up in the shadow of Liberty University and Jerry Falwell. And I grew up hearing that the LGBTQ plus community were freaks and deviants and all of these things. And so I spent the majority of my life hiding. I knew when I was about 5 or 6 years old that I was different, but to make my family happy and to try to have a normal life, I went and I led a pretty hyper-masculine life. And there are pieces of that I still keep in my life, but it wasn't who I was. And when I started coming out about 5 years ago, I apologized to a lot of people for ruining their dreams for my life or their dreams for their lives. But yet I was absolutely miserable. And even since I socially transitioned a couple of years ago, I don't think it's really been until the past month. And of course, the pandemic has been good and bad for people who are transitioning. It's been good that it's allowed us to get a little more comfortable with ourselves and learn, you know, whether it's taste in clothing or how to do makeup or any of 100 different things to do it with a little more privacy and not as much social pressure. It's been bad in that when we've had to start coming out, it's been a lot of extra pressure. And so it's only been within literally the past month that I've really started to get out more and do things more and in environments where I didn't feel safe walking into them. And so I am learning that, you know, if I'm going to apologize to anyone, I need to apologize to myself for the way that I treated myself all those years and not that I don't love the people whose dreams were altered because of me needing to do this. And I'm not going to say a choice because it wasn't a choice. But I don't need to apologize to them anymore. The only person I need to apologize and forgive is myself.
That is powerful. So powerful. I feel like I need to take a minute, take a big, deep breath. That's powerful. So the next question I have for everyone is, so we all know the VCU Health, we have a commitment to diversity, equity, and inclusion, which is rooted in our values, our mission and our values to create this inclusive, safe environment for not only patients, but for families, for our team members as well. So having said all of that, how can our colleagues ensure they offer an approachable atmosphere for the queer community? So how can our colleagues make sure that they create a space that is approachable and that, quite frankly, I'll say that is thoughtful, staying true to who we say we are?
So, in my opinion, I think it's important. I mean, you have to have somebody that is approachable, right? No matter what you're trying to go at them with, whether it's a leader or whomever, you have to have somebody that's willing to have that open mind, have that ability to treat you with respect, and regardless of what it may be, whether it's a complaint, whether it's a concern, whether it's a compliment, whether it's to be able to express who you are, you have to be able to do that. So I think having that compassion and that ability to understand and not judge someone when they're coming to you, regardless of what it is, you know, whether it's a bad situation that they've been in, whether they're a drug user or alcohol user, you have to approach everything the same. I'm here to help you. I'm here to talk with you. I'm here to support you. And you have to be able to have that approach, at least in my opinion, because if not, you know, there's many people that in my life I thought would support me and that I would be able to be comfortable with going to. And they proved me wrong because they were while they said they were going to support, they had that mentality and that tone of being very standoffish and very disengaged and very short. I even recently had a doctor's appointment and the doctor was very short with me and very disengaged of yes, no, very short answers. And you could tell that the doctor was not comfortable in there with me, which made me uncomfortable. So in that sense, I was like, okay, well, I just want to get out of here or maybe speak to someone else. So being able to open up regardless of what your feelings or your thoughts or beliefs are is the best approach, I think.
Thank you, Cody. Patrick.
So for me, it's about communication and education. Rome was not built in a day, and we have a lot of work we've got to do. Even in 2022, we've come so far because I came out in probably 2003, and between 2003 and 2022 now, so much has changed. We went up and then we kind of backslid a little bit, but we won't get into all of that. But we need to just be understanding. We are caregivers. We are here for people. We're here to give care to people, and we need to just be understanding. We need to take that time to ask the questions in a very appropriate and appropriate manner. I'm not really sure how I'm trying to say that, but we need to really get support groups out there. There's so much that people don't understand about our community. A lot of people feel that, we're just out here making noise, and we're just, we're here to just show our agenda in their faces, but there's so much more to it. We've got to really we've got to be better at educating people. And then at the same token, people have got to be more receptive. We can only talk so much. You can lead a horse to water, but you can't make them drink. We've got to really, foster that environment of where people feel comfortable to ask questions. Like Cody said earlier, we're very blessed here. Our administration, our leadership is very supportive, but there's a lot of people that don't have that. Being members of the community as well, we also have to be open and understanding that not everyone is going to be immediately receptive to us. People are going to ask questions, and we need to be open to help people understand. Just like I said, it may sound simple, but just education and communication. Just keep it simple and be there for each other. Be a good human. I mean, after the pandemic and everything that's been going on, we've got to be better at being there for each other and communicating with each other.
We do have to be better. Thank you.
So I think there are also some tactical things that people can do to help be approachable, or to let queer folks know that it's a safe space. I think the first thing is you when you're engaging with someone, try and suspend your judgments and assumptions immediately, and then just dive into some questions, and you can respectfully, but you can say things change your language a little bit. Instead of assuming the person in front of you is heterosexual and married, don't use terms like wife or husband. Say spouse or partner. Don't use ma'am and sir if you don't know how they identify, right? That's a big one, especially in the South. If you're not saying ma'am and sir, you're not being respectful. But if you address someone as ma'am and that's not how they are, you've disrespected them. So you're doing the opposite thing, right? So your language is really important. Say y'all, say everyone instead of ladies and gentlemen. We have pronoun pins. Wear your pronoun pin, right? Because then people know you're a safe space and they're going to engage with you in a little bit more of a relaxed kind of way. From a clinical standpoint, we have the ability to collect that SOGI data. So when you're talking about, which is sexual orientation and gender identity, when you're talking about creating spaces in healthcare, right? You need to know that information, and it's really straightforward in collecting it, right? And then you know that the person before you goes by this name, and these are their pronouns, and then you use them, right? Just because the driver's license says George, but the person in front of you said their name is Patricia, then you call that person Patricia because that's what they told you, right? And this is the same, it's just being respectful, right? My son's name is Alexander, but he goes by Xander. You would call him Xander because that's what he goes by. It's really not different, right? I don't think anybody's asking for anything special. We just want to be treated with the same respect that everyone else is, and ask that you suspend your judgment and assumptions because not everybody is like you.
Thank you. Thank you so much.
So I'm going to try not to repeat anything anyone else said because I agree with everything that they've said. But one thing that I'm going to add, healthcare professionals, especially at institutions like this, can really struggle with saying, I don't know, and let me reach out to someone else for help. As I was coming out, one of the hardest things, almost harder than telling my family, was telling many of my doctors that I was transitioning. And I had, and I'll touch on some other things. I'll expand on this some in one of the other questions that you sent us, Joanne. But, I had people who thought me having migraines was associated with my HRT. No, I've had migraines long before. I had doctors who needed me to educate them on things, which I shouldn't, no offense, I shouldn't be educating my doctor on my healthcare. They should be saying, I need to talk to someone else. They need to be like my PCP. My PCP is a VCU health physician. And when I came out to him after a long pause, and he says it's the most memorable, by the way, doc, I've got one more thing moment of his entire career. But he looked at me and he said, I don't know a thing about trans healthcare, but I'm willing to learn. And if you're willing for me to say, I don't know, and if you're okay with me reaching out to the people who do, I want to remain your PCP and support you. And if a healthcare provider doesn't know, they need to say that. We have some doctors here who are amazing at that. Even before I started this journey, I've got an autoimmune disorder, and the doctor who was treating it, we were struggling to get it under control. And he said, I don't know what else to do. I need to reach out. Okay, go ahead. I have much more respect for someone who's going to say, I don't know, I need help, than someone who's going to ask me to educate them. Because I'm sorry, if I knew, I wouldn't be sitting in the doctor's office. And don't make assumptions. That's a really big thing. Piggybacking on what Julia said, don't make assumptions, not just about the pronouns, but don't make assumptions about the cause. Don't make assumptions that my body is reacting this way just because I'm transgender. So don't be afraid to say, I don't know, to your patients.
Yes, thank you. So I'm going to make sure I say some of these out loud together, okay? So for folks who are watching now and those who are watching later, know what you shared in kind of a small, succinct way, okay? So we said communication. We said being open. We said be understanding. Ask kind questions and be thoughtful. Support groups can really help provide a safer healthcare environment. Receive education and be receptive. Suspend judgment and assumptions at the beginning of meeting someone, whether it's at work or when you're providing healthcare. So that means like changing your language from not saying husband and wife, but rather spouse, partner. Instead of saying hello, ladies and gentlemen, say hello, everyone. Hey, y'all. All right, let's bring all the folks together. And get a pronoun pin. And I would add pronouns to your email address. Add pronouns when you're introducing yourself. If you want to, make sure that you have education behind that before you do so. And by the by, you can get that communication and SOGI education. You can get that information on the internet under the Office of Diversity, Equity, and Inclusion page. You can get that information from any Pride member here at VCU Health System. Ask questions. I'm gonna say this thing loud and clear, Madison. It's okay to say, I don't know. Can I say that again? It's okay to say, I don't know. And if you're willing to say that you don't know, be also willing to find the answers so you can provide quality healthcare, so you can provide a safe work environment. Okay. And I'm going to end on something that Patrick said, because you remind me of something that we say in my family. And that is, with all of these things, it's important. However, these are ways that we are leading a horse to water, but we can't make them drink. So we are encouraging you to drink that water because it's going to make you healthy. And guess what? It's going to make everybody else healthy and work better together. So I have just a couple more questions. So due to a discriminatory treatment of individuals in the queer community that is longer, the history is long and broad, are there any experiences, and we don't have to go in order, so this is just for anyone to answer, are there any experiences that you are comfortable sharing where you felt discriminated or simply just dismissed by a healthcare provider, or even an experience where a healthcare provider did not validate you or even address your healthcare concerns? And that can be for anyone. And Cody, thank you for already offering us an example. So anyone else is free to share that.
Hey, it's Patrick. So for me, back when I lived in Alabama, I went to my primary care, because I was curious about getting on PrEP, and very much like Madison said, if you don't understand, ask somebody. But instead, it being a doctor in the lovely state of Alabama, he almost looked offended. Like he's like, well, what's PrEP? I don't understand. So I had to somewhat educate him a little bit on what PrEP is. And I never will forget, he asked me, he's like, well, aren't you taking other measures? Why do you need PrEP? I'm like, I take other measures, but accidents happen, things break, we get that. So then he proceeded to ask me, he's like, well, why would you partake in activities that could put yourself in jeopardy? If a stove is hot, not to touch it. Why are you doing things that could put yourself in jeopardy? And at that point, I just shut down. I was like, you know what? I had to excuse myself from the situation. But like, as a physician, like Madison said, if you don't know, don't ask your patients. It almost felt like, he kind of was probing to mock me and make fun of, the situation, and just to be so dismissive and passive about, and compare it to touching a hot stove. Like, what is, you're a physician. Why would you phrase it that way? But needless to say, I eventually, after some research, I found a physician who was like, nope, got you. This is what you need. This is how we're going to do it. And had a great experience from there. But, there are people, highly educated people, physicians out there that they still don't understand a lot of things, and, they need to educate themselves. And I really appreciate how Madison phrased that earlier. That's my story.
Thank you, Patrick, for being willing to share that. Very much so. And I'm sorry.
I've got a positive, or another positive and a negative. And ironically, these two instances happened within 24 hours of each other. So my first day of social transition, I just had my legal name change. I was coming in to have some medically necessary surgery done, and I had managed to save up and go through the plastic surgery resident clinic to have some gender affirming surgery done as well. It's my first day of social transition. They called me to give me my surgery time. And I said, by the way, my name was legally changed officially today. Can you please call me by my new name? No. Now, this was 2 years ago. This was before Epic. So let me say that. But I was told no. And I sat there and I explained the whole situation. And I was told, no, we've got to go by what's on your chart. So when I arrived for surgery that day, I was called by my dead name, which was really humiliating because I came presenting as me, and that whole room was packed. Now, I will say, I had one of the most amazing experiences within a couple hours of arriving for that surgery. And both the attending and the resident who were involved in the surgery are no longer with the health system, and I consider it a huge loss for our plastics department. But I was wheeled back to surgery, and I was being prepped, and again, this was my birthday. And they're doing the safety check before the surgery, and they start going around and everyone going through their safety check. And the resident says, hold up, we're going to pause safety check for a minute. In case you guys haven't noticed on the chart, today is Madison's birthday. When I did her pre-op, first thing I said to her was, are you sure you want to do this on your birthday? And her response to me was, this is all I want for my birthday this year. And he said, so we as a team, we're going to make sure that we do this right and give her the best experience possible. Let's get on with the safety check. So, this organization has done some amazing things, and Epic has helped fix that encounter that I ran into. And our patient relations department was wonderful in addressing my concern when I reached out to their team. But we still have areas to grow. We still have areas to improve. And some of it is individual bias and some of it is institutional policy. And we've really got to look at that. When I did my transition, God bless Julia, because when I did my transition, we did not have a transitioning in the workplace policy. And Julia, I was one of the people who worked on that team with Julia. And a lot of what was in there, I don't know how much of it was based off what we submitted to HR for my plan, but a lot of it was very similar to what my director and I had to put together. So we've got policy issues that impact our team members who are also our patients. And then we've got to make sure that we're validating our patients who are not team members as well.
Thank you, Madison. I'm like wiping away tears and trying to figure out how they don't fall harder. Thank you. I appreciate that. Just your openness and you're willing to share those two experiences. I'm glad you had a great birthday that year. Does anyone else have anything to share before we move on to the next question?
I mean, I guess I don't have a specific experience, but and the reason is for that is because it can be terrifying to come out to your providers, and then there's this breakdown of trust, and they're no longer able to provide you with appropriate health care because they are missing whole portions of who you are, and understanding how those things can play a role in diagnoses, social determinants of health, just you have to treat the whole person. And so I don't have those stories because I haven't felt comfortable sharing, right? I haven't necessarily come out to all of my providers. And so, if you are watching this and you're a provider, I want you to think about that. Are you able to treat the whole person that's in front of you? Do you know really who they are and their experiences so that you can provide them health care, right? For all of who they are. So I think that's really important to put out there.
Thank you so much, Julia. I appreciate it. And I appreciate all the work you've done in human resources to make sure that we are working harder every day to build a safer environment for folks. So I'm going to end on this question. What is a change you would like to see here at VCU Health System to promote a safe and healthy environment for all folks in the queer community? And anyone can answer it.
So I think, and I said this last year's or brought this up as a question to the panel last year. I think we could honestly do more to support the community and to support our employees. There's not really a go-to place, right? I mean, kids are coming out at a younger age. Kids are trying to express and figure out their identity at a younger age. We have adults still coming out and figuring out their identity at their ages, and we don't have a support in place for people to turn to be able to provide that mental support for them, and which can be hard, especially if you have a limited amount of family and if that family's been supportive or not. I lost a good chunk of my family when I came out and was disowned. Fortunately, I had a bunch of friends that became my family, and that's who I came to rely on. But that is a big factor. And us being able, as VCU Health, we should be able to have a community support program for our employees and for the community to be able to help support anybody who may be struggling to come out, or somebody who may have already come out and is now struggling because they have gone through that issue or have been kicked out of their house or disowned or whatever the case may be. But I think there's a lot of support there. And on top of that, in my year here, over a year, there's not a lot of, what's the word I'm looking for? Presence or shown of support. We have the pronoun pins, but there's not a lot of anything else out there to show support for the community, to make it not a in your face, but more of a, this isn't acceptable, this is okay here, this is what we are going to support you in this health system. We are going to support you and be here for you, and being able to make our patients feel comfortable and know that they can come to this health system and be supported. And just, pictures and banners. I mean, we have pictures and banners all over the place of families and everything else, but you won't see anything of me and my husband and my child, and we're a normal family. But why don't we have that to be able to help promote that, since we are, like, to my first thing that I said, we are VCU, we are Richmond, we lead the way in the community to be able to help support that. Not to mention, we would be one of the only health systems in the area to provide that community support for youth and for adults and whomever else needs that help and support that could save lives and keep people from committing suicide or anything else, from being able just to have that team there to provide that mental support. So, long story short, I can continue to go on with this, but that's my 2 cents on that.
I love that so much. I'm so glad we got that recorded. Yes, Cody, I 100% agree. We're all over the place. Would I not give to see 2 moms? Would I not give to see 2 dads? Would I not give to see a poster saying that, yes, we do, yes, we can offer healthcare for our transgender community. Yes, we prescribe PrEP. Yes, we do all of these things, all of them. So I love that. Thank you so much.
I agree, Cody. Sorry, I was just going to add to that, even when you think about sponsorship, we sponsor a lot of things as a lot of community events, but I don't see us sponsoring Pride Fest in the fall or any of the Pride events that were happening this past month in the community themselves. So I do think, there's a big opportunity for us to get out there and show our support.
And from my experience, working with other health systems, they have had a big presence in the community. Like, they'll do health screenings. They offer out pamphlets that have got information for all physicians and services offered to the community. That's something that I've not really seen here. The previous hospital system I worked with, they had a whole booth at Pride set up. These are doctors for trans care. These are doctors, everything was completely laid out. And I mean, it was just great information, and it really boosted the health system. It gave a better presence in the community. More people were more willing to seek out these physicians because they knew they were inclusive. So yeah, I completely agree.
And tagging on to that, we do a lot of outreach with our community physicians. Just in the past 2 weeks, I've had 3 doctors call asking, where do they connect with for transgender resources for adult patients? So we've got information with the Children's Hospital posted about transgender care, but also too, it's all scattered between a dozen different locations. But we don't have what, and I'm going to name hospitals here, we don't have a place like Johns Hopkins Transgender Care Center. We don't have a place like UVA's fairly newly developed, only within the past couple years, Transgender Care Center. I realize that we are not going to, it's going to take time before we get surgeons who can do sexual reassignment surgery. There's so few of those in the country that that's going to take time. But we are offering a ton of other gender affirming surgeries and cares. And I have a friend who does outreach with multiple LGBTQ clinics, especially with children. He had no clue that you could get discounted services through our resident clinic. We have community doctors who do not know what services we provide for the LGBTQ community. We tout our PEDS trauma program, which we should. We tout our cardiology program, which we should. But why are we leaving this one program that may be, granted, it's controversial socially and politically on some levels, but if we want to be the leader in healthcare, why are we not broadcasting that to the doctors, not just in the city of Richmond, but all those rural doctors that we serve in Farmville and Charlotte Courthouse and, you know, our Tappahannock area and down into the, you know, the Middle Peninsula in Northern Neck and Louisa and wherever, because there are queer people in all of those areas. And there are clinics out there and there are counselors out there who are trying to help these people in areas where they may not be accepted and they have no idea where to send them.
Oh, I love that. That's such a good way to end this. I'm just going to end it by saying exactly, again, to be succinct, let's bring it all together. And that is these rural areas like Madison's talking about, how do we outreach them? How do we offer them information that we do what we do here at VCU Health? However, making sure we also have a central location. Let's work towards that transgender community health center. Let's do it. Let's make sure that we are offering information, whether it's pamphlets at Pride Fest. And I just want y'all to know that Dr. Davis and I are working very hard to see how we can get some booths at Pride Fest this year. How can we offer safe zone education and certification? We need more up and above, quite frankly, we need more pronoun pins because we've run out. And how do we expand our media that's out there? Like Cody said, we're everywhere. How do we feature a more diverse community that is representative of queer folks? How do we do it? Those are ways we can do that. So I just cannot thank you each enough for being here today. Thank you for your leadership. Thank you for your kindness and your thoughtfulness. Thank you for helping us move in the right direction. You are all amazing. I care about each of you. And I am so happy that you are working at VCU Health System. I think that you're on the top rung, and I just absolutely adore each of you. Thank you for educating us today. And I hope everyone has a great day. Thank you for everyone who attended. Again, encourage your colleagues to see it. All right, go on that internet, see it, and learn. All right, everyone. I hope you have a great day. And panelists, I'll connect with you in just shortly. Thank you, everyone. Bye.